Good morning, everybody. I've got pregnancy and fetal development is our lesson today. So I started this one off with a case study, which I know we've actually done when we were able to have in-person classes, and you guys really enjoyed. This one I just kind of open up with a few slides and kind of try to figure out what's happening here. So we got a case. A 36-year-old female is presenting to the emergency room. Her chief complaint, which is what she's complaining about, the problem, the reason she's there. She's fatigued, tired, dyspnea, which is disordered breathing, trouble breathing, and chest pain. History of present illness are those questions the doctor asks you right off the bat about your chief complaint. So she's had progressive shortness of breath, getting a little worse, and difficulty breathing over several weeks. She can't really exercise, she gets tired, one flight of stairs and she's winded. Substernal chest pain, so that's like right under your sternum here, like right at the top of your belly. Some pain, peaks in the morning and at night. She has a nighttime cough, nocturnal cough. It's semi-productive. She kind of coughs up some clear like goop. She's got some leg swelling and polyuria. I'm sure you could break that one down. Poly means many, right? And urea has to do with urine, so she's going to the bathroom often. Any clues yet? All right. So past medical history. So when they start digging into your past, your family, your social kind of stuff, not really related to your chief complaint, they're digging for clues as to what could have led up to this. So all she's really got in her past medical history is she was slightly overweight. OBGYN as like a subsystem here. She started menses at age 12, which is pretty normal. She's had irregular cycles though, and she's never been pregnant. She's on oral contraceptives, which is birth control, and she takes a multivitamin. She's been married for 2 years, and no exposures has to do with risks she might be taking with perhaps having an affair, things like that. She's not been exposed to anything. I usually pause here and take a note about doctors are pretty much sworn to secrecy except for those couple times that we talked. Your information you tell your doctor is generally considered very private, except in the cases of child abuse and HIV. So a lot of times, people will share all kinds of stuff with doctors, and an affair or cheating is something that is kind of important in cases sometimes. So patients will often tell you that they're doing crazy things, and as a doctor, you have no right to tell the other person about that. Alright, physical exam. So her skin is warm and clammy. She's got a little acne, a little extra hair on her face with a medium coarseness. Her head, ears, eyes, nose, and throat. Basically, looks a little more red than usual, and her thyroid is a little larger than normal. Nothing to be concerned about there. Cardiovascular, she's got tachycardia, which means a fast heart rate. Her heart rate was 107, normal is 60 to 100. Remember, we did a lab, and you guys measured your heart rates. She's positive for jugular venous distension, which is like these arteries here. They're kind of popping out. So you can see, her pulse and her blood. So 2 out of 6 systolic murmurs over pulmonic and aortic arteries. So we listen to her heart, all the valves. There's a PET me. There's 6 different locations you can listen to, and you can listen to the valves that we talked about in class back when we did cardiovascular system. 2 out of 6 of those we heard the murmurs. So that's interesting. Let's see, her chest was clear bilaterally. That just means we listened to her lungs, so nothing particularly odd. Her diaphragm was a little higher than we expected though. So we expected to be able to hear her lungs a little lower, and we stopped hearing lungs a little higher than we expected. Pretibial pitting edema. So you take your thumb, you stick it in where your heel is, and pitting edema means when you stick it in, it squishes and then it doesn't come back out. So that's edema. There was fluid, and we pushed it out of the way literally, and it's going to take it a little while to fill back in. Abdominal. Her skin, she's got spider angiomata and striae. So she's got some stretch marks and these veins coming down into like her belly button. Medium coarse hair, all under her belly button, infraumbilical, and her abdomen is distended, firm, and it's not tender at all. So any idea what's going on yet? So we still got some studies in labs. So they did an EKG. She has tachycardia. We already measured that, so I don't know that I would order that test. Left axis deviation, that just means it's being pushed a little bit further to the left. Chest x-ray, her lungs were clear, her heart is enlarged, and she's got extravascular markings, so lots of extra veins showing up on her chest x-ray. Her labs show that her hematocrit is low, so that might explain a little bit of the lethargy and the tiredness. Her white blood count is high. Her cholesterol is a little high, though they don't give us details on it. And you know, other stuff is pretty much normal looking. So what does she have? And I always kind of throw kids for a loop on this one. They start thinking all kinds of things. You know, everyone's their own doctor with Google nowadays. But you know, some of them catch on and figure out. You know, the title of this presentation is Pregnancy and Fetal Development. So she's pregnant, right? So here's the catch. Every time that a woman comes into a doctor's office, the doctor has to assume that she's pregnant, and we have to ask about it. Because if we do something like an x-ray and she could be pregnant, that's a pretty big deal. You don't want to bombard a fetus that's rapidly developing and splitting cells multiple times over the day with ionizing radiation from an x-ray. But 5 to 10% of women in the ER show up pregnant, and many don't know or show. So you have to assume that any woman of reproductive age can be pregnant, and that affects almost every organ system. I mean, I've jokingly said that babies are like little parasites, and they really are. They will take everything, and the mother's body is happy to give it out. All right, symptoms of pregnancy. So she had irregular periods, right? So a missed menstrual period was no big deal for her. Excessive tenderness in her breasts, being tired, because we've talked about this a little bit, I hinted at it. You're literally creating a baby, another organ, and it takes a lot out of you. Some women get morning sickness. You're gonna have a change in appetite. You know, you've heard about all those aversions and cravings, like pickles and fried chicken, odd stuff. You could still have some spotting or some light irregular bleeding. That's not really a huge deal. Although we'll talk about some problems that might be related to a little later on in the slide. So if you think you are pregnant, the first thing most women do is they go buy one of those test strips that you pee on, so urine test. You're looking for this HCG hormone, which is a hormone that the fetus is going to start creating almost instantly, and your body, through the endocrine system that we talked about, is going to detect that hormone, and it's going to start preparing your body and sending nutrients down to the baby's way. Now these little test strips require quite a bit of HCG. It has to basically be so much in your blood that it overflows into your urine. So that's why it's impressive that they are active, you know, within 10 days of conception. But they're more accurate if you wait more to like where your missed period would have been. So the doctor will order a blood test later on that detects the HCG, and that's generally considered more positive. You usually have to get that in order to get insurance to pay for your pregnancy. They won't believe that you peed on a stick. So cardiovascular heart changes and blood changes. You're going to have positional effects where the heart gets like shifted because the baby's pushing up. And I got some cool pictures later on. We're going to see how the baby develops and things get moved around. The placenta we talked about is a low resistance shunt, so it's going to happily take your blood and circulate it through the placenta for the baby. A little parasite. Hematologic, your blood volume is going to almost double, and your red blood cell count is going to increase a little bit, which creates this relative anemia. So it seems like you don't have enough oxygen capacity in your blood, but it's just because your volume has increased so much in order to support this extra little thing that's growing inside you. So here's a cool little chart. Yeah, I love the chart. Oh man, this thing's beautiful. So here you got blood volume, plasma volume. Ooh, we talked about plasma, red blood cell mass, the number of red blood cells you have. So everything kind of lags here, following the plasma. So plasma is just like the watery thing filled with proteins, and see that's just wow. You could make a nice linear equation out of that. You could do change in y over change in x. So ooh, what would the slope be? It would be let's see, plus 10% over 4 weeks. So 10 over 4, 5 halves, 2.5% increase per week of pregnancy. Bam! Up until about 32 weeks. That's a pretty good fit. Anyway, former math teacher. I'm sorry. Maybe you maybe that helped you out. So here we got delivery, and everything's a steep drop off. You lose a lot of blood during the delivery, and then obviously your body doesn't have the demand for it anymore, so everything peaks off. All right, changes in the pump. So your heart gets displaced. You are very common to have murmurs in almost all your valves. They call it mammary souffle. And you typically get an increased rate. 80s is normal. Because you got all that extra blood, so you got to pump it around. Ventricular distension, so the ventricle side, everything in the veins gets a little increased pressure. So here we're talking about those positional changes. So this isn't the best picture here, but each like little top here. And when you're pregnant, you go to see the midwife with either your wife or if it's happening to you. They'll measure and try to find the top of this, and it's a pretty awesome judge of how far your pregnancy is along, especially if you're not sure when conception happened. They can press into your belly and they can feel exactly where the uterus is. And I always like this one here because you see it's going up, 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 32, 36, and then 40 drops down. It's because the baby's head like engages into the pelvis, so everything actually drops down. So you look the most pregnant at around 36 weeks, and then you actually get a little less pregnant. But at the same time, you look more pregnant because you have to waddle around because there's a baby's head inside your pelvis. So anyway, this will, as it grows, push and displace. So remember we talked about the diaphragm being higher in our case study, the heart being displaced, right? It's shoving all those organs up, and they got to go somewhere. So your ribs kind of expand out, and everything gets pushed up. All right, so here's some better pictures here from the side. So if you notice, baby's kind of floating around here in the top up until about 24 weeks, and then hopefully the baby's supposed to flip over and be upside down. So they start by kicking your bladder a little bit, and then they start kicking all your vital organs. So that's always a fun time. Okay, I think we've talked about the displacement of the heart and the lungs and all that enough. So what happens to your intestines? So you might get a little constipation. You might get full quickly, right? There's not enough room up there. You might get some reflux, some gastroesophageal reflux disease, heartburn. Again, there's no room, so your stomach literally can't fill up as much as it used to. You might get some nausea and vomiting, and that's often proportional to that hormone level. Fortunately for me and my wife, we didn't really have a lot of that, but some people get very, very sick. Liver, gallbladder, just that's not stuff that you necessarily need to know, but again, there are changes body-wide. All right, so here's some of the striae, stretch marks. This can be partly genetic. A lot of times women just think, hey, I'm pregnant, and they think it's a ticket to eat as much as they want, that they're going to gain a bunch of weight. I think the average weight gain for a healthy pregnancy is about 30 to 40 pounds, but a lot of women put on 80 plus, and that can really stretch your skin out because your body wasn't expecting to gain that much weight that quickly in certain areas. And these will be there pretty much forever. This is kind of a cool one, hyperpigmentation, so increased color, right? Hyperpigmentation. It's also called the linea nigra, and that's this line here. I guess, I don't know if you can see my mouse, I haven't figured that out yet. So this little line down her belly here, that's a horrible color to pick. That's called the linea nigra, so literally it means black line. So basically everything that, like freckles and stuff when you're pregnant will get a little bit darker. It's just part of being pregnant. Oh boy, how do I go back to clicking the slide? I guess I don't. All right, other adaptations. You won't be able to see your feet. The center of gravity changes, so you have to wobble a little bit. joint laxity is actually kind of a fun one as a chiropractor. You get this hormone called relaxin that increases in your body, and everything just pops and cracks, and it's easy to adjust a pregnant woman. The symphysis pubis, which is the front part of your hip we talked about, that has to widen and open, and it can actually be kind of painful. Eventually it will pop open. But your hip joints have to relax, right? It's the hormone name relaxin, and they'll spread out so that the baby can make it through the hole in your pelvis. So thorax widen costovertebral, which means your lower ribs are going to like bridge out a little bit. You got to make room for the heart and lungs to go somewhere. And fatigue that you have to deal with from making the organ in the first part, and then the baby literally just taking all the nutrients you're eating later on. Oh, and we mentioned about weight gain. The baby only needs about 500 calories a day. That's not that much. We think about 500 calorie packs goldfish. That's like, 2 cups of goldfish. It's not that much more. So, all right, breast changes during pregnancy. So, first trimester, your breasts will feel swollen and tender. Your nipples will start to change because they're going to get a little bit bigger. Something that a baby could find. That hyperpigmentation is going to actually make the areola a little darker. Because when the babies come out, they're practically blind. So what they're really looking for is like a color difference, and then they think that's a nipple and they go for it. All they really are working on at that point are reflexes, and there's a suckling reflex, and so they find that darker spot and they go for it, and they start to suckle, and they hope that they get milk. That's why you could put a little later on, if you put your thumb in a baby's mouth, they'll kind of gnaw on it. They'll do that suckling reflex, and it's very soothing to them. They like that because they associate it with food. And that's why binkies or pacifiers or whatever your family calls them, that's why they work so well, because they trigger that reflex and they make the baby, they literally plug them up. We did that for our first child, and we really kind of didn't like it. We didn't do it for the rest of them. It was very hard to take away from our firstborn. Second trimester, so your breasts are going to get larger and heavier. They're going to start making some milk that kind of sits in there. And importantly, they're going to start making colostrum, which is this first kind of milk that the baby's going to have. It's not really milk. It's actually full of antibodies. It's super important that the baby gets the colostrum. So there are actually animals that if they don't get the colostrum, they will die. When we had baby goats, it's important that you find out that they got that. It sets up your immune system to go. So in humans, it's not the end of the world, but I don't know how many studies have been done on it. It's pretty important to set up your immune system, and I really want my kids to have that first milk. It's this yellowish discharge. It's not really like, in fact, after the baby's born, it actually takes a couple of days for your milk to come in, and that colostrum is the first thing the baby's going to get. Third trimester, breasts get larger and even heavier. And there's all kinds of adaptations to clothes you're going to have to make here. It's not really relevant to this class, but it's in here. So bra or bra extender. They have this thing called the belly band, so you can keep wearing your pants that you normally would wear, but you have to like unbutton them. And then they also have like pregnancy pants, which are literally just stretchy top fabric, so that the pants can grow with you and the baby. The leaking is probably colostrum. Some women don't have leaks, got nothing to do with your ability to breastfeed. Most women, even if you have really small breasts, are still able to breastfeed. From conception to birth, so we're supposed to talk about the development, fetal development. So we got 3 different periods here: the zygote, the embryo, and the fetus. So zygote is the smallest, and I guess I should just put a slide here. So that begins when the egg's fertilized in the fallopian tube. So rapid cell division. Remember, we don't want to X-ray. We just X-rayed this woman in our case study, so that's not great. Probably not going to cause any trouble, but she didn't know she was pregnant. She affirmed she wasn't pregnant, and it turns out she was. So it ends in 2 weeks, pretty short period, when the zygote implants in the wall of the uterus. That's where you hope it implants. I think we've talked about implantation outside of this before, ectopic pregnancies. So period of fertilization, the zygote here, so it gets fertilized somewhere in fallopian tube, and then it starts dividing, and eventually implants on the wall of the uterus, where it's going to be able to absorb all those nutrients from mother. So the embryo is from 3 to 8 weeks. the body parts are formed, and the embryo rests in a sac of amniotic fluid, which is basically just pee. We've talked about that before. And then the umbilical cord is going to join the embryo to the placenta, which is the organ of the first trimester. So here we go. We got structures here. So baby's upside down, so we know this is after like 24-ish weeks. And we got our umbilical cord wrapping around the baby. And in delivery, all kinds of terrible things can happen with that. If you have kind of a longer one or a shorter one, it can cause trouble. It can get wrapped around the baby's neck, and the heart rate will go down. And those are the reasons that you really want a professional like a midwife or a nurse midwife or an OB at your birth. And you don't want to just do this by yourself in a car. Alright, so here's the uterine wall, and you can see the villi. We've seen that before in different systems where it increases the surface area, so lots of stuff can get transferred. We don't need to go into that terribly detail. Alright, so fetus is the majority of the pregnancy. So from 9 weeks to birth, everything just increases in size, and the systems practice and begin functioning. And we've talked about this before. I definitely remember standing on the table and telling you about how soon a baby could live outside of the womb. Remember the womb service? It was great. Yeah. So 22 to 28 weeks, depending on what level NICU is nearby and how fast you could get there. And that's amazing. So here's first month, and we're going to speed through this stuff a little bit. There's all kinds of cool services. I know my wife signed up. We got cell phones nowadays. You can sign up for like weekly updates where it's like, oh, your baby's the size of a pea. Now it's the size of a blueberry or a little cutie. And it's kind of fun to read along about what's happening to the baby along those points. So at this first month, it's only about 1/10 of an inch long, which is super tiny. What's that? Like, oh, it's a couple poppy seeds. Oh, I didn't read that yet. I just came up with it. Anyway, move on. So here's a picture, first month, and we got that weird kind of, vertebrate look that a lot of things look like as they're developing. You probably learned all about that in biology. So embryo is about 1 inch long at 2 months. So what's that? That's like a little grape. Oh, cool. So you can see your veins. The heart actually has a right and a left chamber at this point. So here, looking like a little alien. So big brain is developing here to kind of direct all of the growth. 3 months. Now we're 2.5 to 3 inches long. So this is like the little cutie. And if this is your first pregnancy, I mean, you're not even showing yet. You still got a tight little belly. And now, if it's your second or third pregnancy, by 3 or 4 months, you're actually looking quite pregnant because your body's like, hey, I'm used to this. And it's already stretched out to that point, so it's easy for it to stretch. In your first pregnancy, it's a lot harder to stretch that out because everything is tighter and it hasn't stretched out to that point yet. So at 4 months, you get this kind of thick covering of hair called lanugo, and you might be able to feel your baby kick you. And it's cute at first until they start kicking you in the bladder. So here we got our amniotic sac. So at the end of the pregnancy, when we're jumping up here, when your water breaks, this is what's coming out here, this amniotic fluid, and it's actually sterile, so it's not. I mean, pee is sterile too. The only thing you're concerned about is any like bacteria that might have been on the outside of the vagina. That's why when you do like urine tests or drug tests or anything along those lines, you have to do a clean catch, which means you start the flow of urine and then you throw the cup under there. That's so any of the bacteria that was on the outside of your genitals is not in the cup. It doesn't provide like a false, like, oh no, you have a bladder infection kind of thing. So urine is sterile, amniotic fluid is sterile. It's actually the baby's urine. When you're in there, you practice swallowing it, and your kidneys get to filter it, and then you pee it out, and that's your amniotic fluid. So I guess your water being broken isn't the mom's pee, but it's baby pee. So 5 months, you get this vernix caseosum, which is on the baby's skin, and that's something that I've never understood. When the baby gets delivered in a hospital, they like drag the baby away and they like scrub it off, so you get this nice, perfect pink baby. But a lot of the more I don't know what politically correct way to say this, but people like us, we'd rather leave that on. It's not going to do anything but protect the baby for a little bit. It comes off in a day or two with their little baths. You have to wipe them down. Eyebrows and eyelids are developing around 6 months. The lungs are still filled with amniotic fluid because obviously there's no oxygen down in there. Well, there's oxygen, but no gaseous oxygen. So if you talk or sing, the baby can hear you, and a lot of people will like read them books, and this is the time where they'll like really start kicking if they hear like a favorite song or they hear mom or dad reading. And this is a good time for dad to get involved because the baby's going to hear mom's voice all the time, which is part of the reason that's so soothing afterwards. But if they hear dad's voice all the time, then dad's voice can also be kind of a soothing thing that they're comfortable and used to. So here's some of that lanugo, the downy hair, and the vernix caseosum. Oh my goodness, scrub that off that baby. 7 months, so 3.5 pounds, actually getting kind of significant here. 12 inches long, a well-formed body. And again, this is the point where most of the time we can save a baby like this. They have full fingernails. 8 months, half a pound per week. They're really putting it on now. So at this point, you might need a little more than 500 calories for the baby to keep growing here. So things are getting kind of tight in there. 9 months, baby's a hefty 6 to 9 pounds, measuring between 19 and 22 inches. And you might feel them move around a little less because things are getting kind of tight. And at this point, the baby's growth is actually pushing on the cervix, which is going to help start to dilate it and open up that path. And again, they've also dropped into the pelvis, hopefully. I was going to talk about some problems, but I've got lots of slides on those. And we're doing fairly good. Slide 41 of 69. All right, general risk factors for pregnancy. So nutrition. Our case study was taking folic acid, to pull back to our case study. Well, she said she was taking a multivitamin. There are such things as prenatal multivitamins, which have extra folic acid, which helps prevent spina bifida, which I've got a picture of in a later slide. But it's important to get the right amount of food, and protein, and vitamins and minerals because the baby's developing and creating all these systems from new. It's important. Oh man. In class, I would have totally gone off on a tangent about multi-generational effects because I just read about them, looking up some hydroponics stuff to grow some like fresh lettuce and stuff with nutrient feeding technique. Anyway, it was talking about having micronutrients and how the first generation of plants will be able to survive without the micronutrients, but after that, they won't. They'll die. The micronutrients were in the seeds, and that was all the micronutrients the plants needed for their life, but they wouldn't be able to put those micronutrients into the next generation of seeds. So there's actually, and I still went off on a tangent, there's some multi-generational things that we might be doing to ourselves as a species by not having adequate nutrition. So just think about that a little bit. It might not actually show up in your child, but when your child goes to have a grandchild, there could be an effect on that grandchild from the choices you made as a pregnant woman. So that's very interesting. I'm sure there's a path of study you could go into if that interests you a lot. Stress, obviously, is important to try to not be that stressed. Biggest one that most women worry about, I think, is the actual delivery. But we could be talking about work stress. You could be stressing out the baby. That decreases the oxygen, and that can have implications for the baby too. So important to try to de-stress a little bit. Mother's age, you don't want to be too young. You don't want to be too old. There's pretty much a premium age in there for having a baby. And here's teratogen. So terata really literally means monster, and gen, coming from like Genesis, means making. So monster makers is the literal meaning of this word. And generally that refers to like drugs and chemicals, but it can be all kinds of things that will disfigure and basically break the baby. So here are some just common problems. This is not any particular cause, but these are some common problems with teratogens like alcohol and drugs, cocaine. There's all kinds of terrible things that happen to babies in this world. So here's drug-exposed babies and other babies. So the ones that are exposed to all this stuff, breathing problems almost triple, low birth weight almost triple again, feeding problems are huge. And I mean, if you go into looking into this, when we when my wife and I did foster care for a little while, and some of the stories you hear about, babies coming out addicted to drugs like cocaine, and they have to be on withdrawal medication, and they're having withdrawal symptoms. I mean, it's just terrible. But most of those babies get either placed with an adoptive family and then taken care of, or they get taken care of. It's just a sad beginning. All right, signs of labor. So there's a show, which is like this mucus plug that comes out that plugs up the cervix, which is the bottom of the uterus. And when it passes, right, because the baby's head is pushing on it and dilating, you'll get this mucus plug and a little bloody discharge. That's often some of the first signs. So contractions. So you're going to feel these things called Braxton Hicks contractions throughout your pregnancy, and some women get lots of them, some women not so much. But these Braxton Hicks contractions can happen weeks before the actual labor starts, and it's just, your belly will tighten up. The actual contractions are a little more intense, as I've been told. So they're going to help push. Basically, contractions, the uterus squeezes the baby, and then the baby's going to push down into that cervix and dilate it. So you're just slowly like open, 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 and every time you open it a little more until you get to that 10 centimeter magic mark you always hear about in the movies. The water will break eventually, right? The sac, that membrane, as it's getting pushed down and out, will kind of pop. It'll tear at some point, and the water will come out, and that triggers your body to speed up the process a little bit. Sometimes it doesn't break, and there's actually some really cool videos. Obviously, be prepared for seeing some things you might not want to see, but where babies are born, like still in the amniotic sac, the membrane just didn't rupture. Sometimes it pops, like as the baby's coming out, and there's like this like explosion of liquid. All right, moving on here. So here we got 2 centimeters, 4, 6, 7, 8, 9, 10. 10 is what you're looking for. 8 to 10. If you push earlier than that, you risk doing a lot of damage to yourself from tearing. And even at 10 centimeters, depending on the size of the baby, there's probably still going to be some tearing. But that's all part of what's supposed to happen. And like I said, if you have a professional there, they'll judge the urgency of the blood loss and things like that. And they'll stitch you back up at the end, and things will return to normal eventually. All right, so cervix dilates, longest stage, takes a while. Our first baby, my wife had contractions all through the night, and we ended up at the birthing center, and they basically told us to go take a walk. And that was actually nice, because if we ended up in a hospital sitting in a bed, probably everything would have stalled out. We would end up having a C-section or something with the first one. Stages of labor. So first thing, after all the contractions and everything, you're going to deliver the baby once dilated. We talked about the uterus is contracting to push the baby out. Once the baby's head is visible, right, because you were pushing the baby down, pushing the baby down, pushing the baby down, eventually the baby's head will be visible. That's called crowning, and that's generally when it's things are happening, the baby's coming. So this stage the stage delivery of the baby will end with the delivery of the baby. Wow. But a lot of people don't think about the fact that there's still an organ in there called the placenta that you created that still has to be delivered. So the baby will come out, and they'll be, as long as they're happy and healthy, attached to the placenta via the umbilical cord. So there'll be this cord from the baby up through the vagina, back into the uterus to the placenta. And once that baby is out there, you guys, most of you did those short stories about like the changes that happen in the baby when they're born. All these different little valves and plugs and shortcuts close up. And we talked about the placenta. I mean, it'll keep feeding and supplying nutrients for 5 minutes after the baby's born. So there's really no rush to go in there and cut it. But all those changes are going to be happening. And the placenta is going to be basically cutting off its ties to the uterus, and it will be delivered 15 to 20 minutes after the fact. No worries, though. It's generally much, much easier to deliver than anything else. If it doesn't happen naturally, then it has to be removed. So types of birth. There's natural birth, which is doing it without drugs or surgery. There's induced labor. When we talked about hormones back in the endocrine system, we talked about oxytocin, the love hormone. So it makes, it gets feelings of closeness and bonding with the baby, but it's also important. It's what makes the uterus contract. So if you induce labor, you give this drug called Pitocin. And Pitocin and oxytocin, right? You can see the same like little root word there and suffix. Those they have a similar act in the body, but Pitocin is a lot stronger and kind of a harsher effect. So it makes the contractions kind of painful, which is what leads women into wanting, to get the epidural and the pain blocking, and then they can't feel anything, so they can't really tell when they need to push, and then sometimes they end up in C-sections. So, everyone points the finger at everyone else for why the C-section rate's going up so much. It's because the doctor wants to go to his golf game. Is it because we're doing Pitocin and all this stuff too early? Are we just giving it away too often? Are we like just letting women schedule things because their life is too busy? There's all kinds of reasons, but the C-section rates are going up dramatically. And as someone who has, as a couple, we've done natural births for all three of ours. It's much nicer way to bring a baby into the world. Breech birth is when the baby is like sideways, or they come out foot first, which can obviously be a problem. So if you got one foot coming out and one foot still stuck up there, and you only got a 10-centimeter hole that's made for like a head, a baby's head to come through, and then like the shoulders are actually kind of harder. That's a problem if your foot comes out first, and that could end up with the baby needing to be taken out via C-section. So that's a real reason for needing a C-section. So you can have the hospital, which is often called safest and quickest method. We did it at a birthing center, our first one, right next to a hospital, which made us feel good because, you're nervous. You can listen to me all day and have me say that, oh yeah, it'll be fine in a birthing center or at home. But the first one is going to be make you nervous, right? You don't necessarily know if you're going to have a clean, easy pregnancy. Home birth, some women do choose to do first time. And that's what I said about professionals. If you got a midwife there, or nurse midwife, whatever your state allows, you can be in your own home. You can get up, you can walk around, you can eat for a little while. And when you're in the hospital, they generally put you in a room and tell you to sit there. And that's another reason I think we end up stalling pregnancies and going to more C-sections than we should be. There's also cool things called water births, and I would typically show a video of this. Where we talked about it in class, where little twins are born in the water, and then they go and they hug each other just like they were in the womb, and it's just adorable. So typically for low risk pregnancies, and the baby's just born from a water environment to another water environment, and that placenta is pumping nutrients to them, so there's no rush. It just kind of eases the transition for them. And there's some crazy things people talk about if you had a rough transition from your birth, then maybe that leads to you being like a high risk taking person that's always stressed out. And I think honestly there might be some truth to that. So we've talked about midwives a little bit. So they're there, they know about babies and delivering babies and when things are an emergency and when they're not. Like I said, you get a little more comfortable, so the cleanup isn't in your house. You might be right next to a hospital. When the baby's born, you get this cool thing called an APGAR score. So this is another reason to have a professional there. They're going to do an APGAR score, and they're going to decide whether that baby is in good condition, it needs assistance, or it needs life-saving techniques. And it has to do with respiration, if they're making noise, are the reflexes present, are they being irritable, pulse and heart rate, skin color, muscle tone. And so there's this little, does the baby have this and this and this? What level is it? And then what score you give them. So 7 or higher is what you typically want, and that's the baby's going to be, breathing and crying. The reflexes are all going to be there. They're going to be in this position here, this like flexed up position, and that's something that professional is going to be able to handle with you. All right, so types of disabilities for babies. So here we got fetal alcohol syndrome. So this is caused by alcohol consumption during pregnancy. And when you do that, it might cause Down syndrome, low birth weight, small head, abnormal facial features. And the most distinct one is usually the indistinct philtrum. So you got these two little bumps right beneath your nose. People who went through fetal alcohol syndrome typically do not have those. And there's some other things here that you might be able to see. Thin upper lip is kind of a normal one. Yeah, all these other ones are pretty in depth here. what else do we have? Miscarriage. So a sad thing. The general statistic is that 50% of all pregnancies end in a miscarriage, which means that the fetus was lost before the 20th week of pregnancy. But if you notice here, only 15% of recognized pregnancies end in miscarriage. So most of the time, this miscarriage happens before you even miss your period, and the woman just doesn't even know that she had a baby get conceived and implant and everything else. It just kind of leaves with the next period. 15% of recognized pregnancies end in miscarriage, though, which that is always kind of a sad thing. That's why a lot of couples will wait for a while before they announce that they're pregnant, because the miscarriage is a very real thing, and you don't want to get all excited, get your family all excited, and then get a big letdown. So symptoms of a miscarriage: you got bleeding from light to heavy, severe cramps, abdominal pain. Generally, this is you need to go see a healthcare professional just to make sure that if it's an ectopic pregnancy, that could be very life-threatening. So what are the causes? They're not really well known. It could be a bunch of environmental stuff, smoking, drinking, drugs. Babies are amazing, though. They will survive. Certain medications like acne drug Accutane, which I know a lot of teenagers end up still using. It gets worse as you age. It could just be that there was something wrong with the fetus and it decided to kind of abort itself, and that's all fine. Nothing that the mother or the father did. Stillbirth. So stillbirth is what it's called. It's not called a miscarriage anymore. After 20 weeks of gestation, it's called a stillbirth. So stillbirth happens in 1 out of every 200 pregnancies. So I mean that's not that low of a statistic. That's pretty high, right? I mean, you probably went on 200 car trips in a year. If you got in an accident and 1 out of every 200 of them, that'd be pretty scary. So again, it's still not something you can worry about. It's just going to be, you'll actually have to deliver the baby if it's a stillbirth. So causes are a lot of the same stuff. There could have been a defect in the growth and the baby just aborted the growth. Placental abruption, so that the uterus got torn away. You see like terrible things in movies where like these men will like push their wives downstairs to get the baby to basically become a stillbirth, or hit a woman in the stomach. And this is the concern here, is that you'll get this placental abruption, or you'll literally damage the baby enough that it will have a defect. That's all terrible things. So. And this is all nutrition related again here, so you gotta take care of yourself and your baby. So types of disabilities: Down syndrome, and I had a video. Oh, I know which one this is. There's some really cool advocates for Down syndrome. Some of them have Down syndrome, and they take you through. This might be the Rainbow Bagel one that I really enjoy. Anyway, it was blocked by the school Wi-Fi now, which is weird. I think it says the F word like once. But it made a good point about accessibility in New York and how it really was hard for someone with Down syndrome to get around. Anyway, cleft lip, palate, that's when the parts of the face don't actually develop. Usually that's more of a you get delivered really early. Club foot we got here. One or both feet are twisted. They just need surgery. Spina bifida, so this is the folic acid one. So if you're pregnant or might get pregnant, you should really be taking a prenatal vitamin at all times to prevent spina bifida. So that is when the spinal cord actually, the vertebrae don't develop quite right, and it herniates, it comes out. So your spinal cord, it doesn't go straight down to where it needs to go, it comes out. And this is I believe, spina bifida vera, which is the true form, where the spinal cord is actually all the way out here. And there's also spina bifida occulta that came to me. Occulta means hidden, so hidden spina bifida. So if you, and I guess you're all probably at home, so if you go look in the mirror right now at the small of your back, and there's like some hair there, some like darker hair, that's actually like a super low level like spina bifida occulta. It probably doesn't mean anything for your long-term health, but some people have that. And it could be, if you have an x-ray, that you might see some deformations in the bones here where you had a little bit of spina bifida, which would just mean you lacked folic acid when you were developing this as part of you. And it might not be you. I mean, your parents might have done everything to have the right nutrition. Sometimes it just happens. But having that vitamin B9, the folic acid, always present in your body can just prevent this very easy to stop thing from happening. Postpartum depression. So this is a common topic that, half of all moms feel some irritation, resentment, they'll end up crying a lot. 10 to 15% might get a very severe postpartum depression. We talked, I think, in either the last video or the one before this, we saw that chart with all the hormones. And basically, once the baby implants itself and it's, a zygote, all those hormones just start going woo, way up and out of here. And once that happens and then the pregnancy happens, it's like the blood chart, the graph I really liked. At 40 weeks, they just go and they tank. And that amount of hormone change in such a short period of time can cause some intense feelings of depression and missing all that stuff. Breastfeeding can help a lot with this because it helps release that oxytocin, the love hormone. It's going to make bonding with the baby, and just overall supporting the mother. And if you have that professional, which you always should, the midwife or someone is going to be able to check in with you. The doctor should check in with you, make sure that you're feeling all right and you're handling all this well. Because, babies are no joke. Sleeping through the night for a baby is considered 5 hours of sleep. That's not sleeping through the night for adults. So it can be tough, and you definitely need a support system. You shouldn't be doing it alone. All right, so ART, assistive reproductive technology. So talking about infertility, and I always like to talk about a little bit of history where, it always used to be blamed on the woman. If a couple couldn't get pregnant, it was a woman's problem. She did this, she did that, she doesn't have this. And a lot of times, oh no, I lost my cowboy. A lot of times, the man is actually responsible. So what do we got here? 2% in reproductive age just have infertility-related issues. 15% had an infertility-related medical visit at some point. I think we're going to get into the techniques here. So infertility affects 10% of reproductive. 25% of couples have more than one factor, so it could be low sperm count, could be odd anatomy. In 40% of infertile couples, the male partner is the cause. So look at that. It's not always the woman. So irregular or abnormal ovulation accounts for 25%. Most infertility can be treated with regular therapies such as medication or surgery. So if you're trying and you've been trying for more than a couple months, right, that's the definition of infertility and you can't get pregnant. Basically, you're going to go into your doctor, they're going to look for the cause and they're going to try to fix it. And oftentimes it can be fixed rather simply. You don't have to go into this 5% where we have to do in vitro fertilization and things become more difficult. Alright guys, I am back. I guess I chose powerful laptop over battery. So, common female infertility. Blocked fallopian tubes could be due to pelvic inflammatory disease, endometriosis, cysts, congenital abnormalities. There's these interesting things that can happen where your uterus is like off to a certain side, or it's got a really much more narrow spots, so things can't flow through them the way they're supposed to. This is like the worst looking reproductive system ever here in this photo. So we got like some cysts here. It looks like cobwebs almost, but that's actually just fibrous adhesion, scar tissue basically, and that can impede the flow of things. Sperm can't get out, egg can't get in, fertilized egg can't get to where it needs to go, and then you can't conceive. All right, common male infertility factors. There's actually something where you don't make any sperm cells called azospermia. Oligospermia, which we've seen oligo, that prefix before, that means few. So not many are produced. And oftentimes when you have these, the sperm cells that are produced are malformed and they're not going to be able to reach the egg before they die. Other genetic diseases may also cause infertility. We got a little image of sperm cells kind of not doing their job, just sitting there. Alright, artificial insemination. Supposed to talk through this. So basically, it's any means of introducing semen to an egg that is outside of the uterus, or it could be into the uterus, but by not natural means. So there's several different types. The most common that you've probably heard of is IVF, or in vitro fertilization. That's when in vitro means within, like the vital aspect of it. So they take eggs from the woman, they fertilize them in the laboratory with the man's sperm, and then they return the fertilized embryos to the uterus. So we talked about Octomom a little while ago and some of the stuff that happened with that. And typically they put like 3-ish successful embryos in there, and they hope that 1 or maybe 2 will implant and become a baby. And it just bypasses all that stuff we saw in the cobwebby uterus picture, where there's it bypasses any scar tissue or other problems, or if the sperm don't swim well, then you're putting them right next to the egg, so they don't have to swim very far to get to the egg. So there's lots of different ways to do this. IVF is just the most common. They're combined in the laboratory dish here. Fertilization occurs outside, and then they put them in. There's also GIFT, gamete intrafallopian transfer. They put the eggs and the sperm in the fallopian tube, and then they just hope it happens naturally. So that's a little closer to what's supposed to happen. Zygote intrafallopian transfer. So that this one, they actually let the zygote split a few times, and then they put it in the fallopian tube and hope that it implants. And then we've got intracytoplasmic sperm injection. So this is if the sperm literally can't even penetrate the egg. They will try to put the men's genetic information right into the egg and then transfer it. So all kinds of different things that can happen, and this is a very, very expensive process. I mean, this is like a mortgage your house, drive a cheap car for the next 30 years kind of deal. It's going to cost tens of thousands of dollars, and it might not even work. But many people find that it is worth the process. So the goal of every couple dealing with infertility is to have that positive pregnancy test, and it can be very expensive and time-consuming. And that is it. Happy birthday.